Hi, today's video is about Medicare Part D. Now, Part D is your prescription drug coverage with most Medicare plans, and it's been around since 2006, was created by the Medicare Modernization Act of 2003, and they rolled it out in 2005 with implementation in 2006, so it's been around for a while. When the government first created Part D, they created what was called a standard plan design. And whether you purchase your Medicare Part D plan as a standalone plan or through a Medicare Advantage plan as part of that coverage, it still has to meet or exceed the standard plan design. So I put a little doodle together to show you what the plan design looks like. And so watch that, and I'll be here at the end, and we'll talk in a moment. Medicare Part D, or prescription drug coverage, was introduced with a standard plan design, and that's what we're going to go through today. It consists of 4 phases, and the first phase is the deductible phase, which was originally designed that you pay 100%, and that deductible amount changes each year. Once you've satisfied that deductible, you reach the initial coverage phase, which was designed for insurance to pay 75%, you pay 25%. And when the total cost of your medications, the deductible, the 75%, the 25%, reaches a certain dollar amount, then you enter the third phase, which is the coverage gap. The gap is also known as the donut hole, and it's gone, but it's not forgotten. Nowadays, you pay 25% of the gap. And to get through the gap, you must reach what's called your true out-of-pocket, or TROOP, which is a tricky number to determine because although the amount changes every year, the calculation is complicated. And then the fourth phase is the catastrophic phase, where coverage is 5% of the cost of medications or less. There's a couple of other things to note about standard Part D. There is a late enrollment penalty that you can incur if you don't sign up when you're first eligible, and you'll pay that penalty for the rest of your life. The other thing you might want to be aware of is there is something called low-income subsidy that provides additional coverage for people with low incomes. So I know, super confusing, right? It's a good idea to at least have a basic understanding of how Part D works with the deductible, the initial coverage phase, getting to the gap, which I know I said is gone but not forgotten. Originally, when they rolled out Part D, the gap was 100% your responsibility. Now it's down to 25%. Insurance companies treat the gap differently than the initial coverage phase. So that's why I say it's gone but not forgotten. It's just different. And then there's the true out-of-pocket, which I know I said is hard to figure out, but I really tell you the best thing to do is go to that Medicare.gov, not .com, .gov, plan finder tool, plug in your prescriptions, plug in your preferred pharmacy. It's going to tell you all the different phases, how your drugs are covered. So the next section of this video is going to talk about medications and their tiers. So medications are grouped into tiers, and so the next section of this video, the next doodle, is going to explain what the tiers are and kind of how they work, and a couple of other things that you should know. So watch the doodle, and I'll be back here at the end. Thanks. Medicare Part D drug tiers explained. Part D plans use formularies and tiers to set costs for medications. With most insurance companies, Tier 1 medications are preferred generic drugs. Typically, these are lower-cost generic medications with the lowest copays. Tier 2 are your generic drugs, which are higher-cost generic medications and have higher copays. Tier 3 is your preferred brand-name drugs. These are brand-name medications without a generic equivalent. Tier 4 is your non-preferred brand drugs, and these are brand name medications that do have a generic equivalent. So if you choose to take the brand name rather than the generic, you'll typically pay more in a copay or coinsurance.
Tier 5 is your specialty drugs. These are high-cost specialty medications that are often used for treating things like cancer, MS, ALS, things like that. Additional things to know are a medication's tier can vary by insurance company. You'll see one company will have a medication at tier 1, another tier 2. Formularies can change, typically not throughout the year, but that can happen. It pays to shop around each year during the annual enrollment period to make sure that you're on the right plan for the following year. And Medicare.gov has a plan finder tool that you'll find very useful.
So now you know a little bit more about tiers. And like I said, tiers can change from one insurance company to another. So again, those plan finder tools, almost every insurance company has one. So you can go to their website and enter your drugs each time. Or again, you can go to Medicare.gov and use their plan finder tool. It's going to show you all the plans available in your area. So annual enrollment period takes place between October 15th and December 7th. Every fall, that's your chance to change your plan for the following January 1st. So you're never going to be stuck with a plan for more than a year, which is good because if your prescriptions change, there's a whole host of things that can change in the course of a year. And so you never want to be stuck with a plan for more than 12 months. Formularies change. Sometimes a medication will be covered this year. They don't cover it next year. Again, it's really important every fall to look at what those plan changes look like. Premiums can change from year to year. Sometimes plans will go away and a new plan will be offered. The other thing is deductibles. So the deductible, which as you saw at the beginning, was originally 100% your responsibility. A lot of insurance companies have changed that, and they'll make tier 1 or maybe tier 1 and 2 prescriptions not subject to the deductible. So you don't pay that deductible first, you go right to the copay or the co-insurance, what you pay. And then other companies, all of the drugs are subject to the deductible first. So it pays to shop around. It really is worth your time to seek professional help. Find a Medicare certified agent in your area or call Hartman Insurance at 507-288-3834 and ask to speak to a certified agent in your area that can help you find the right plan for you for next year. So I'm Janice Domke. I am a certified Medicare insurance agent. I'm with Hartman Insurance, and we are here to help you find the right plan for you and to answer your questions. So again, give us a call, 507-288-3834. We'll see you soon. Be sure to hit the subscribe button so you know when the next video comes out. Take care for now.